Knock, knock, knock. Hi, I'm Amanda. I'll be your nurse today. How are you?
I'm doing well. How are you?
Nice to meet you. What's your full name?
Ryan Spitzer.
Ryan Spitzer. Awesome to meet you, Ryan. I'm just going to go ahead and do some hand hygiene here. And put on some gloves. Ryan, I just have to do like a full head to toe assessment on you. That involves like touching you and checking you over in some places. Is that all right?
Yep.
Okay, awesome. And then would you just confirm your date of birth for me?
3/8/86.
Perfect. And do you mind if I just look at your wristband? Awesome, that matches. Okay. What brought you in today?
Chronic migraines.
Oh, okay. All right, awesome. Well, so do you mind if I just get a few vital signs first while I'm here?
Sure.
I'm just gonna put this blood pressure cuff on you. All right, and let that run. All right. How are you feeling today?
Pretty good overall, I guess.
Okay. I think you seem to have a pleasant mood. Do you know where you are today?
Bryant Stratton Hospital.
Perfect. All right. And do you know who the president is?
Donald Trump.
Okay. Here, let's try this down here. Perfect. And do you know what year it is?
2025.
Perfect. Let the air out of this really quick. Here. Let's try it one more time. Sorry, it's sleeping. There we go. All right, so you're alert and oriented. You have a positive mood. Do you feel pretty happy?
Yeah.
Do you get pleasure in activities of daily life?
Yes.
Okay. Do you struggle with any thoughts of wanting to hurt yourself?
No.
Okay, awesome. So your mood is positive. Excellent. All right. Well, I'm going to go ahead and, do you have any pain, by the way?
Not at the moment.
Not at the moment, okay. All right. Do you sometimes, do you have pain that comes and goes?
Just when I have migraines.
Just in the migraines. Okay, perfect. Are they brought on by anything in particular?
I'm not sure.
Okay, no worries. That's pretty common. I'm just gonna go ahead and take a look at your scalp. Your general appearance looks very clean. Your hygiene looks appropriate for a situation. You look well maintained. I'm just gonna go ahead and feel for any lumps, or abrasions. Good. Behind your ears here. No abrasions. Your skin is intact for the most part. I do see you might have cut yourself shaving right there.
Yeah.
Yeah, that's not uncommon. Your skin is normal for ethnicity. Your skin is warm to the touch. And I don't see any other abnormalities. Can you smile for me? Good. Your smile is symmetrical. Can you shut your eyes really tight? Perfect. Can you blow up your cheeks? Okay, you can open your eyes. Thank you. And then can you stick out your tongue? Move it left and right. Perfect. And then just say, ah. And it looks great. I'm just going to go ahead and look in your nose here. Mucous membranes look moist, pink, and intact. Have you ever been told you have a deviated septum?
Yes.
Do you have trouble with sleeping?
I have sleep apnea.
Do you use the CPAP?
Yes.
Okay, perfect. Yeah, that's exactly right. Are you able to move your eyebrows up and down? Good, symmetrical, that's great. Go ahead and look inside of your ears here on this side. If I had an internal ear scope, I would be able to see your tympanic membranes, but the skin's intact. I don't see any external blockages on any of that. I'm gonna go ahead and look on the other side. Yep, skin is intact. Again, I would be able to see your eardrums there if I were able to look. Looking behind, the skin's all intact, warm. No lumps, bumps, abrasions, bruises, anything abnormal. All right. I just like to see if your pupils react. It just means I shine this light in your eye just to see if your pupils will constrict. Is that okay?
Yeah.
Just look straight forward for me. Good. That's reactive. Same thing on this side. Good. And then if you would do me a favor, would just keep your eye on the pen. I'm gonna bring it in towards your face and just, I just wanna see if your eyes accommodate, okay? Followed in, perfect. All right, I'm just gonna test your fields of vision here. So without moving your head, would you be able to just follow the pen? Sit you up a tiny bit. Yep. There we go. Sit you up a little bit. You comfortable like that?
Yep.
If you would just follow it, I'm gonna just follow with your eyes and try not to move your head. All right, so I'm gonna left up here, down, same thing with this corner, down, good, up, down, and left to right. All right, all your fields of visions are intact. That checks some of your cranial nerves there to make sure that you can move your eyes. Are you able to just open your eyes a little bit so I can look in at your, yeah? Do you mind if I just pull a little bit and look at your conjunctiva? Looks pink, moist, intact. Not see any signs of infection. Have your eyes been bothering you at all?
No.
Do you wear contact lenses or glasses?
No.
And are you able to see pretty well, see everything across the room?
Yep.
Okay, awesome. I do want to just do a test for your hearing. So I'm just going to hold this and I'm going to whisper. If you could just tell me what words I'm saying. Pink balloon.
Pink balloon.
Perfect. I'm just going to do this one. Yellow banana.
Yellow banana.
Perfect. Do you have any trouble with hearing?
No.
Do you wear any hearing aids?
No.
Okay, awesome. That is great. I just want to check a little bit of range of motion. Are you able to look up fully and look all the way down?
Yep.
Awesome. And then ears to your shoulders on either side. Perfect. And then just turning your head left and right. Yeah, patient has full range of motion. That's excellent. And then the last thing for your range of motion included here is your shoulders. You just shrug for me. Can you shrug up to your ears? Perfect. That's symmetrical. Very good. And you can release. Shoulders look symmetrical. Equal strength. While we're just checking your strength, do you mind grabbing my fingers here and squeeze for me? Good. Strength is equal. And then now pull them towards you. Nice. Strength is equal. I'm going to do the same thing on your feet. If you would just push up towards my hands for me. Good. Strength equal. And then if you point your toes to the ceiling, would you push on my hands like gas pedals? Perfect. Equal strength. Are you able to lift this leg up? Good. And the same over here. Good. Any pain while you're doing that?
No.
None. Okay. I just want to check out your chest here. Do you mind if I palpate?
That's fine.
I'm just going to palpate here for any lumps or bumps. Would you just say a basic sentence for me? I'm just going to check for tactile fremitus.
A quick brown fox.
Good. No fremitus here that's noted. Your lung tissue density looks to be appropriate. While I'm here, I might just take a listen. So when I put my stethoscope down, each time I move it, would you just take a deep breath for me?
Yep.
We'll listen on your side here. Once more. Excellent. Do you mind sitting up for me so I could listen to your back? There you go. Perfect. All right. Perfect. Your lungs sound clear. The rest, I don't see you using any accessory muscles. The effort seems normal, no strain in your or labored breathing, and your depth seems very good. It seems like you have deep breaths. Are you a swimmer or anything like that?
I do a little cardio.
Okay, there we go. That's probably why. That helps a lot. That's great for you. Now, are you a smoker at all?
Occasionally.
Occasionally. Okay, not every day. All right. Well, while I'm here at your arms, do you mind if I just check your radial pulses? Perfect. Those are both strong 2+, equal bilaterally. And then I want to just check your carotid pulse. I'm just going to check one at a time. Good, that's 2+ strong. And 2+ strong. While I'm here, I wanted to check out your sinuses. That's right up under your cheeks here. Just press a little bit. Is that tender at all?
No.
Feels nice and soft. I don't feel like your sinuses are swollen or anything. And do you mind just opening your jaw for me? Good. Any popping sensation there when you open? Seems good and strong there. All right. And your maxilla would be over here. Some lymph nodes. And all that seems nice and soft and appropriate and symmetrical bilaterally. I'm just observing some of your skin on your chest. There are no lumps, bumps, or bruises. The chest tissue looks normal. I do not see any abnormalities in the tissue, and the nipples are symmetrical on both sides. Do you mind if I go ahead and touch your stomach?
That's fine.
I just want to check the quadrants here. I'm going to go ahead and listen first. You have active bowel sounds in all 4 quadrants. I'm just going to lightly palpate if that's okay. Down here in your right lower quadrant, you can get your gallbladder, your spleen, part of your pancreas, and your liver. Part of that liver comes up here into your right quadrant, as well as your kidney. In your left upper quadrant, you can have part of your liver over there as well. And you get your kidney. In your right lower quadrant, you're going to have your descending colon, and you're going to have your stomach up here in the left, and then down here you'll have your ureters and things. All right, all of that feels normal. Abdomen is slightly rounded, but certainly not distended. It's still very soft. I do not see any issues there. I would like to check a couple more pulses. 2 that are behind the knees is your popliteal, your tibial, and then if you wouldn't mind slipping the shoes off, I just want to check your pedal. I'll just check your posttibial here, or your popliteals. And that's 2+. Come over here. It's 2+. I'm just gonna feel back here. Strong, good pulses. Your skin is intact on your legs, I can see. Your hair is evenly distributed, and that's 2+. If you don't mind slipping off your shoes. Thank you. I'm just gonna check your pedal pulses. Both strong, 2+. Do you mind if I just look between your toes? I just want to check for skin breakdown. You're not diabetic, are you?
No.
Okay. See here, absolutely no breakdown. The skin actually looks very healthy. Great. The skin is not shiny. Your hair is evenly distributed. And let me just check your cap refill here. Yep, less than 3 seconds. I'm gonna check on your finger here. Yep, less than 3 seconds. That's great. I do not see any evidence of circulation insufficiencies or peripheral vascular disease. I do see some old scarring. Is that maybe from falling down or some work injuries? Okay, that makes sense. Have you had any past medical history or past surgeries, anything like that?
I had cardiac ablation for AFib,
Oh wow. What year was that?
2019.
2019. Have you had any cardiac issues since then?
High blood pressure,
Okay.
and that's about it.
Okay. Does it make sense that your blood pressure is 150/93?
Yeah.
Is that about normal for you?
Yeah.
And do you take any blood pressure medications currently?
Amlodipine with diazepam.
Okay. And are you on any other medications or supplements that you take daily?
Prozac, hydrochlorothiazide, Zetia, rosuvastatin, and I think that's it.
Okay. And your doctor, do you have a primary care who reconciles those meds and make sure they don't interact?
Yes.
Perfect. Good. And have you been on them for a while and know that they are working pretty well for you?
Yes.
Have you noticed any adverse side effects from taking those?
A little bit of peripheral edema from the amlodipine.
Okay. Yeah, looking at your legs here, I do not see any peripheral edema right now. Are you on any diuretics or anything like that?
I think that's what the hydrochlorothiazide is.
That's right. Okay, so that seems to be working for you.
Mm-hmm.
Perfect. All right. Oops, I just cannot keep this pen light in my hand. Would you mind, here, I'm gonna lower the bed all the way down here. Would you mind just, do you use any assistive devices for walking?
No.
Okay. If you don't mind, I'll have you get out here and just, there we go. Oh, the trash can's crushed. That's okay. Here, I'll fix it. And do you keep an eye on your weight?
I try to, yes.
Okay. All right, if you don't mind here. Have you had your BMI calculated?
A while ago with
Okay.
my cardiologist.
That's all right. All right, do you mind standing up here and just take like 3 or 4 steps this way, 3 or 4 steps back? Perfect. And back. Very steady. Gait is even, balanced. Are you able to do all your activities of daily living on your own independently?
Yes.
Okay. Do you work currently?
Yes.
Okay, awesome. Do you find that you have any pain in daily movements?
No.
Are you able to reach down and touch your toes for me? Perfect. Any pain in your lower back when you do that?
No.
Okay, awesome. Do you feel dizzy at all when you do that?
No.
Do you feel dizzy at all when you stand up?
No.
Perfect. Do you mind just coming over here and stepping on the scale? Perfect. I'll just move these a little bit. All right. Excellent. Does that look to be about what you normally weigh?
Yes.
Perfect. All right. Thank you. You have one more seat here, sir. Thank you so much for your patience with us today. I'm just going to make a quick note of these things here today. All right, take my gloves off. And just a few things before we leave here today. Have you had your annual flu shot?
No.
No. Is that something you wanted any information about?
No, I'm okay.
Okay, perfect. And then, do you have any allergies?
Not that I know of.
Not that you know of. Okay, you've never had a reaction to any medications or anything?
No.
Are there any concerns you've had other than the migraine that you wanted to talk about today?
No, I'm good.
All right, perfect. Thank you so much for coming in, and we Really appreciate that you let us do this today.